Welcome to our YouTube channel, where we discuss a topic that affects many men and their partners: premature ejaculation. Premature ejaculation is a common condition that can cause significant distress and affect sexual satisfaction. In this video, we'll explore what premature ejaculation is, its causes, and the various treatment options available. We'll also provide practical tips and strategies for managing premature ejaculation and improving sexual function. So, if you or someone you know is dealing with premature ejaculation, be sure to stick around, and let's get started. What is premature ejaculation? Premature ejaculation (PE) is a sexual dysfunction characterized by the inability to delay ejaculation during sexual activity, leading to a shorter duration of sexual intercourse than desired. It is a common sexual health issue that affects many men at some point in their lives. PE can be classified as either primary or secondary. Primary PE is when a man has experienced early ejaculation since his first sexual encounter, while secondary PE occurs when a man has developed early ejaculation after a period of normal sexual functioning. There are various factors that can contribute to premature ejaculation, including psychological and physical factors. Psychological factors such as anxiety, stress, and depression can play a significant role in the onset of PE, while physical factors such as hormonal imbalances, prostate problems, and nerve damage can also contribute to the condition. Treatment options for PE may include behavioral techniques, such as the start-stop technique and the squeeze technique, as well as medications such as antidepressants and topical anesthetics. It is important to seek medical advice from a healthcare provider to determine the best course of treatment for your individual situation. How does ejaculation work? Ejaculation is a process by which semen, a mixture of sperm and other fluids, is released from the male body during sexual activity. Ejaculation involves several steps and is controlled by the nervous system. The process of ejaculation begins with sexual arousal, which causes the brain to signal the release of hormones that stimulate the production of semen in the testicles. During sexual activity, the muscles around the reproductive organs begin to contract, which leads to the buildup of pressure in the seminal vesicles. As the pressure builds up, the muscles at the base of the penis begin to contract rhythmically, forcing semen through the urethra and out of the body in a process called emission. The sensation of ejaculation can vary from person to person, but it typically feels like a series of pleasurable contractions in the pelvic region. Once ejaculation is complete, the body enters a refractory period during which it is temporarily unable to achieve another erection or ejaculation. This period can last from a few minutes to several hours, depending on various factors such as age and overall health. It's worth noting that while ejaculation is a natural and necessary part of sexual functioning, it is not essential for sexual pleasure or intimacy. Many individuals and couples can enjoy fulfilling sexual experiences without necessarily engaging in ejaculation. PE and ED. Premature ejaculation (PE) and erectile dysfunction (ED) are two distinct sexual health issues that can affect men, but they are not the same condition. As mentioned earlier, PE is characterized by the inability to delay ejaculation during sexual activity, leading to a shorter duration of sexual intercourse than desired. In contrast, ED is the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. While PE and ED are different conditions, they can sometimes be related. For example, some men with PE may experience anxiety or stress related to their condition, which can contribute to the development of ED. Similarly, Some men with ED may become anxious about their ability to perform sexually, which can lead to a shortened duration of sexual activity and the development of PE. It's important to note that both PE and ED are treatable conditions, and there are many different options available for managing these issues. A healthcare provider can help diagnose the underlying causes of these conditions and recommend appropriate treatment options based on an individual's unique situation. Causes. There are several potential causes of premature ejaculation (PE), which can be broadly categorized into psychological and physical factors. Psychological factors that can contribute to PE include anxiety, performance anxiety, relationship problems, and general anxiety can all contribute to the onset of PE. Depression. Individuals with depression may experience changes in their sexual functioning, including early ejaculation. Guilt. Feelings of guilt or shame related to sexual activity can contribute to PE. Stress. High levels of stress can lead to changes in sexual functioning, including PE. Physical factors that can contribute to PE include hormonal imbalances. An imbalance in hormones such as testosterone or serotonin can contribute to the development of PE. Prostate problems. Inflammation or infection of the prostate gland can contribute to PE. Nerve damage. Injuries or conditions that affect the nerves in the pelvic region can contribute to PE. Certain medications. Some medications, such as antidepressants, can have an effect on sexual functioning and contribute to PE. Genetics. Some evidence suggests that genetics may play a role in the development of PE. It's important to note that in many cases, there may be a combination of both psychological and physical factors that contribute to PE. A healthcare provider can help diagnose the underlying causes of the condition and recommend appropriate treatment options based on an individual's unique situation. Diagnosis. Diagnosing premature ejaculation (PE) typically involves a physical examination, a review of medical and sexual history, and sometimes additional tests or questionnaires to assess sexual function. During a physical examination, a healthcare provider will look for signs of physical conditions that may be contributing to PE, such as prostate problems or nerve damage. The healthcare provider will also likely ask questions about the individual's medical history, sexual history, and any medications they are currently taking. They may also ask about the individual's sexual habits, including the frequency and duration of sexual activity. In some cases, additional tests or questionnaires may be used to assess sexual function. For example, a healthcare provider may use a stopwatch to time the duration of intercourse, or they may use a questionnaire such as the Premature Ejaculation Diagnostic Tool (PEDT) to help diagnose the condition. It's worth noting that diagnosing PE can be challenging because there is no standard definition for what constitutes premature ejaculation. However, a healthcare provider can help determine whether an individual is experiencing PE based on their unique situation and symptoms. If you are experiencing symptoms of PE, it is important to speak with a healthcare provider who can help diagnose the condition and recommend appropriate treatment options. Treatment options. There are several treatment options available for premature ejaculation (PE), including both behavioral and medical interventions. The most effective treatment approach will depend on the underlying cause of the condition, as well as the individual's unique situation and symptoms. Behavioral interventions for PE include start-stop technique. This technique involves stopping sexual activity when the individual feels close to ejaculation, and then starting again after the sensation subsides. With practice, this can help individuals learn to better control their ejaculation. Squeeze technique. This technique involves squeezing the head of the penis when the individual feels close to ejaculation, in order to delay ejaculation. Kegel exercises. These exercises involve contracting and relaxing the pelvic floor muscles, which can help improve ejaculatory control. Counseling or therapy. Therapy can help individuals address any underlying psychological factors that may be contributing to PE, such as anxiety or relationship issues. Medical interventions for PE include topical anesthetics. These creams or sprays contain numbing agents that can reduce sensitivity in the penis and help delay ejaculation. Antidepressants. Certain antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, can have an effect on sexual function and help delay ejaculation. Phosphodiesterase 5 inhibitors. These medications, commonly used to treat erectile dysfunction, can also help improve ejaculatory control. It's worth noting that while there are several treatment options available for PE, it may take some trial and error to find the approach that works best for an individual. A healthcare provider can help determine the most appropriate treatment options based on an individual's unique situation and symptoms. After treatment. After treatment for premature ejaculation (PE), many men report an improvement in their sexual functioning and satisfaction. Depending on the treatment approach used, individuals may experience a variety of outcomes. Behavioral interventions, such as the start-stop technique, squeeze technique, and Kegel exercises, are often effective for improving ejaculatory control in men with PE. With practice, individuals can learn to better control their ejaculation and increase the duration of sexual activity. Topical anesthetics, such as creams or sprays, can also be effective for reducing sensitivity in the penis and helping to delay ejaculation. These products can be applied directly to the penis before sexual activity. Antidepressants, such as SSRIs, can also be effective for treating PE. These medications can help improve ejaculatory control and increase the duration of sexual activity. However, they may also have side effects, such as decreased libido or difficulty achieving orgasm. Phosphodiesterase 5 inhibitors, commonly used to treat erectile dysfunction, have also been shown to improve ejaculatory control in some men with PE. These medications work by increasing blood flow to the penis, which can help improve erectile function and ejaculatory control. It's worth noting that the success of treatment for PE will depend on a variety of factors, including the underlying cause of the condition and the individual's unique situation and symptoms. A healthcare provider can help determine the most appropriate treatment approach based on an individual's needs and preferences. With effective treatment, many men with PE are able to improve their sexual functioning and satisfaction. In conclusion, premature ejaculation is a common condition that can cause significant distress and affect sexual satisfaction for both men and their partners. The condition can be caused by a variety of factors, including physical, psychological, and behavioral factors. Fortunately, there are several treatment options available for premature ejaculation, including both behavioral and medical interventions. The most effective treatment approach will depend on the underlying cause of the condition and the individual's unique situation and symptoms. With effective treatment, many men with premature ejaculation are able to improve their ejaculatory control and increase the duration of sexual activity, leading to improved sexual functioning and satisfaction. If you or someone you know is experiencing symptoms of premature ejaculation, it's important to speak with a healthcare provider who can help determine the most appropriate treatment options.